USMLE Question 1. A 32-year-old woman presents to the clinic with complaints of numbness and tingling in her feet and hands. She has been feeling more irritable than usual, and her family reports that she is easily upset. She also mentions feeling increasingly fatigued and having difficulty concentrating. On examination, she has distal muscle weakness and decreased sensation in her hands and feet. She has been taking isoniazid for the past 2 months for latent tuberculosis. Which of the following is the most likely cause of this patient's symptoms? A. Vitamin B6 pyridoxine deficiency. B. Vitamin B12 cobalamin deficiency. C. Vitamin B1 deficiency. D. Vitamin B9 folate deficiency. E. Vitamin B2 riboflavin deficiency. Answer: A. Vitamin B6 pyridoxine deficiency. Explanation: this patient is most likely suffering from vitamin B6 pyridoxine deficiency, which can cause peripheral neuropathy, convulsions, and hyperirritability. The deficiency is often induced by isoniazid, which inhibits pyridoxine's conversion to its active form, pyridoxal phosphate, PLP. The patient's neuropathy, irritability, and fatigue are consistent with this deficiency. USMLE Question 2. A 50-year-old man presents with a history of fatigue, weakness, and paleness. His medical history includes chronic alcoholism. On physical examination, he has a smooth, red tongue, tenderness to palpation over his spleen, and pale conjunctiva. Laboratory results show microcytic anemia with sideroblasts seen in the bone marrow. The patient also complains of numbness and tingling in his extremities. Which of the following is the most likely cause of this patient's anemia and peripheral neuropathy? A. Vitamin B6 pyridoxine deficiency. B. Iron deficiency anemia. C. Vitamin B12 cobalamin deficiency. D. Vitamin B9 folate deficiency. E. Vitamin B2 riboflavin deficiency. Answer A. Vitamin B6 pyridoxine. Explanation: this patient's symptoms are consistent with vitamin B6 pyridoxine deficiency, which can cause sideroblastic anemia due to impaired heme synthesis and peripheral neuropathy. The patient's history of chronic alcoholism puts him at risk for this deficiency, as alcohol interferes with vitamin B6 metabolism. Sideroblastic anemia is characterized by iron accumulation within the mitochondria of developing erythroblasts.